Good morning and welcome, and I am Dr. Peter Holmes, orthopedic surgeon, host of your program, Ask the Doctor. My guest this morning is Dr. Stefan Kiesz. Dr. Kiesz is a cardiovascular and endovascular and takes care of your blood vessels. If you have any questions for Stefan in the future, any of my other guests, two ways to reach me. Do it through my foundation. That's needfoundation.org or fax 696-9012. You have a very interesting past. You and I were talking. Where did you do your training?
Well, I graduated from the medical school in Warsaw, and I trained, as a matter of fact, behind Iron Curtain. I was very privileged. I was able to do the first, one of the first balloon procedures in the heart behind Iron Curtain. My first mentor was Andreas Granzig, who developed the procedures himself. And the reason I ended up in the U.S., as you know, at that time was martial law, I was in Solidarity.
Right. I remember because I'm old enough. Go ahead.
Anyway, so I came here only for 3 months to show what I was able to do there with angioplasty in the heart to replace the open heart surgery. I was a frustrated surgeon. I was supposed to be a surgeon.
Right.
I didn't want to join the Communist Party, so that was my career was not good.
Right.
So anyway, so Andreas asked me to stay here.
You will comply. Is that was it? And you didn't.
You don't want to say what I
okay, go ahead. Go ahead.
Yeah, so, you know. So anyway, so I stayed here on political asylum. Make long story short, I did my residence in Philadelphia, Jefferson. Then I went and Bryn Mawr Hospital, and then ended up in Penn State as a fellow. That was my second training. I had to repeat everything what I had to do, and then I was faculty here at university for 11 years. I was able to work with Julio Palmas, who, you know, developed the stent. That's why I came here, actually, to San Antonio.
Right. So you were sort of the leading wave of this, a new concept.
Yes.
Entirely.
Yes.
When you first came in from behind the Iron Curtain, this was a new procedure.
Yes, sir.
Entirely on that thing. And probably
That's
people
correct.
looked at you and said, what are you doing?
That's
right?
true.
I'm not trying to... Yeah,
no, that's true. It's
right?
very true. Yeah,
and especially probably... threatened, or I could see the cardiovascular surgeons, you know, think, whoa, you know.
Yes.
Was that true?
Yes, cardiovascular and vascular surgeons as well. Because, you know, I developed the methods. I took the stuff from the heart and put them in the legs. I didn't know that I wasn't supposed to go below the knee,
right.
But I didn't want my patients to lose the legs. So to prevent the major amputation, you had to go below the knee and stuff. So, you know.
Okay, let me ask you, Stefan, why do you think San Antonio has so much vascular disease?
Well, you know, we are genetically somehow challenged because we have a high incidence of diabetes. We have a great food here, Tex-Mex, and we do smoke, and we don't move too much. So the combination of this, it culminates downtown. Downtown, I see, if you guys go for any parades, you see a lot of people on the wheelchairs. Okay, and so I thought that it was unacceptable. San Antonio is numero uno in terms of amputations in the country. And number two, in terms of mortality, among cardiovascular mortality, from the heart attack and stuff in diabetics, right after New Orleans. So,
is this related to the medical society, or is it related to genetics and the foods and not taking care of yourself?
You know, I think my idea, you know, I always like to blame myself.
Okay.
So I'll blame myself. You know, I think we should look at ourselves, but also I think this is just only recently being realized with the statistics, because you know, unless you have offices downtown, you don't see it.
Oh, I see it. I see it now orthopedically.
You do.
People want to know why their knees are worn out, and I'm just going to diverge. And for every extra 100 pounds on their belly is 600 pounds of force on their knee, because it's a factor of 6. Exactly. And I'm sure for every 100 pounds of belly, the heart has to pump harder, does it not?
Exactly.
Or the blood, and the same sort of thing.
Yeah. So obesity and all this good stuff, I think patients sometimes don't care or don't know. But I think the education and then, you know, very aggressive medical and device therapy will make a difference. As a matter of fact, we published the papers, as you know, when we can decrease the amputation with critical limb ischemia, when you have a huge ulcer on the foot and they want to chop your foot, we can decrease from 25% to 2%.
And well, the other thing too, as far as attitude, I think a lot of patients think it's not going to happen to them.
Exactly.
Okay, in other words, I can eat as many tortillas as I want. My sugar can go to 180, 190 because it's not going to happen to me.
Or 300.
Or oh yeah, I'm being polite.
Yeah,
or 500 until it happens to them.
Yeah.
And then it opens up and they go, oh, what the heck?
It's kind of late, yeah.
You know, this can't be. And it's always the first time it sort of slaps them around the face.
Exactly. I see people who end up on dialysis. Once you get on I have a lot of patients who are on dialysis. Diabetics on dialysis in their 30s who are blind, we have no legs. It's horrible.
Right.
And this is all preventable. We prove by our San Antonio Nevasca Heart, as you know, we have research department and people coming from overseas and stuff. And we prove with aggressive medical therapy, with modification of your lifestyle, we'll help you with that. And with our newest techniques, which are absolutely state-of-the-art, we can change that.
All right, with that, we'll take a break, get back to that. My guest, Dr. Stefan Kiesz. Dr. Kiesz is a cardiovascular, vascular interventionist. Any questions for Stefan in the future, any of my other guests? 2 ways to reach me. Do it through the foundation, www.needfoundation.org, or fax 696-9012 to ask the doctor. Good morning and welcome back. I am Dr. Peter Holmes, orthopedic surgeon, host of your program, Ask the Doctor. My guest is Dr. Stefan Kiesz. Dr. Kiesz is a cardiovascular, endovascular interventionist. And Stefan, before we took a break, you just whipped a number by that was impressive to me, but I want to go back over. You say with the procedures that you're doing in the legs, you've decreased the amputation rate from 25% as an average down to 2%.
That's correct.
Am I correct?
Yes, you are.
So 25% is like in European countries, here, whatever, before these procedures are done, or?
This is the amputation rate, major amputation rate, which happens with critical limb ischemia, which means once you have infection of the bone.
Okay.
You have ulcer on your foot, you have infection of the bone, and usually if they do the transmetatarsal amputation, they cut half of your foot.
Right.
Okay, this is not going to heal without the intervention, so they go say, hey, what about the below the knee? Or
right.
You know what, we have this great joint now, so let's go above the knee.
Right.
You know, this is nonsense, okay? This is probably the oldest procedures known to
well, it's well written up in the Civil War manuals. It's not that
or
old.
even in Egyptian papyrus.
Well, you're older than me.
Thanks. Appreciate it. Yeah.
Yeah. Well, actually, probably is.
I actually know history. You know.
Okay. All right. Yeah. No, but true. That's sort of the end stage. We call it revision surgery. Is you amputate until they're bleeding, and then you close up, and then.
Yeah, so
orthopedically and cardiovascularly, that's a disaster because of the amount of effort then it takes to walk. Cardiovascular demands with above knee amputation increases 40%. A lot of them then can no longer walk.
So in this very high-risk group, this is the first study in the world. We call it Save a Leg study. We actually presented this at TCT, which is the biggest meeting in the world, you know, in Washington in September this year. It's published as an abstract. So anyway, 220-some patients, prospective, you know, so we follow these patients prospectively. We combine very aggressive medical therapy. So aspirin, Plavix, all the stuff which we use for the heart. The statin drugs like Lipitor, Crestor, you know, we give high doses, reverse that stuff. We work our patients, control you. You know, I don't want you to walk with a sugar of 300. Nothing is going to work. So, you know, and with our new devices, we go above the knee, below the knee. We go as far as the big toe. When you clean it up, you have a very good chance.
Put it simply, I'm an orthopedist, and is this like the guy that comes and cleans the roots out of my sewer pipes?
A little bit more sophisticated, pretty much yes. I'm
Same
a plumber,
price?
Yeah. I'm a plumber,
I got a special plumber.
Yeah,
okay.
Sure.
But do you actually clean out or
yes,
as
open up with the balloons, with the scrapers, rotors, you know, just restore the blood flow.
Okay.
The foot, as you know, the bones and everything lives on blood flow. It's like the heart lives on blood flow. If you don't restore the blood flow, what are we talking about?
Right.
You restore the blood flow first, and then you keep all the medications so you don't clog up the pipes.
Now, do you also stent the peripheral vessels as well?
Well, you stent them, but you stent them very sparingly.
Okay.
Just mainly above the knee. Below the knee, you try to avoid it. Although there are some new devices, and you know, the things are progressing forward. But there are some very smart devices on which, as you know, I worked also, that you can remove. You can remove the tissue, or you just use special lung balloons. Now with medications. And
stop it from coming back. All right, we'll get back to that.
Yeah.
My guest, Dr. Stefan Kiesz. Dr. Kiesz, obviously he's an endovascular interventionist. Any questions for Dr. Kiesz in the future? Any of my other guests care to help my kids with no insurance? Go through the web, www.needfoundation.org, or fax 696-9012 to ask the doctor.